And with that, we will move on to the medical sector. I do not have a report from Henderson Healthcare. I would like to put it out there that they are starting to do presentations about their expansion project, and it's pretty big, it's pretty impressive. If there is someone on here that wants to speak that I didn't catch, let us know. Otherwise, I will turn it over to Jim from York General.
Good morning, Lisa. Good morning, everybody. I'll start off, and thank you, Laura, for all the discussion there this morning. I'll start off with, as I do, with state hospitalization data. And we had a little uptick yesterday in that, and I was just hit the refresh button again, and the state hasn't updated yet through the 31st, so just waiting for that to happen. But we went from 102 patients statewide in Nebraska hospitalized with COVID to 116. And I haven't seen it where it's at yet today again. But a week ago, we were at, that number was 109. So we're just still hanging around that area, not really making much of a dip, but down in the lower hundreds is certainly good to see, and a far cry from back in last November still, when it was up near 900 or 987. So that's still doing really well in that regard. As Laura mentioned, across the worldwide, I can tell you, and the U.S. and even in Nebraska, we've seen a slight uptick in total cases. As Laura mentioned, our data for the health district is down this week when it was up a little bit the week before, but York County overall has been still down from 2 weeks ago, and the last 2 weeks I think have been heading down. So that's been good to see for our county. And so that's a little bit on the hospitalization. As far as our testing numbers, before I get to the vaccination side of things, we, through our emergency room, our outpatient setting, and our inpatient setting, wherever we've done COVID testing, the number this past week was 16 individuals, and the week before it was 15, and the week before that it was 16. So staying pretty level there. We had no positives through our no positive test results through those of testing. And I know there were 10, I believe, in the last week. This was Tuesday to Tuesday that I'm talking about. So that number's probably changed a little bit, Laura, now. So I think, excuse me, I've got the safety huddle going on just over here. Hopefully you can't really hear that too well. But overall, testing numbers have been down, and they've been pretty consistent that way. And so that's also good to see on our end. We have no COVID inpatients that we've had, and we've had no no COVID inpatients, and also no employees currently out for COVID-related reasons. So we have 12 signed up for Test Nebraska today. So we'll see what comes in our Test Nebraska numbers today as well. Hang on just a second. Sorry about that. That didn't do much better. So what I want to say about the vaccines, and Laura said, I think this will be our highest number by far, and it ends up being 660 if we get everything that we planned for vaccines to happen. And be 400 first dose around there, 260 second dose. And we did start out with the 50 and over. 50 and over. And I think we did have to dip down and fill in some that are 18 and over. And Laura, I believe we also did a test run of about 50 using the new VRAS system too. And I think that, from what I know, worked okay. We'll see how that goes today. And that's the scheduling system through the state. So prior to today's clinic, we had 3,000, just short of 3,700 vaccines that we delivered through our York General Clinic. And that's going to, again, go up probably by about 600. So we ought to be over 4,200, 4,300 by the time time we get done today. So huge clinic, a lot of volunteers, a lot of people working at it, across the community. So it's always great to see. And that clinic, I think every week is continued to run better and better. So that's a kudos to everybody involved in that. Hearthstone continuing to do well. The county positivity rate dropped down below 5%, which means we have to test our staff less and less. I believe once a month now, which is a great positive for us to have. And so the residents and the tested or the visitations inside the building are going great. So again, great news on that end. Willowbrook just continues to hum along and get back to closer to normal all the time. And that's wonderful to see as well. A couple non-COVID things that I wanted to mention too is you've heard about the Interstate Project, and that's going along well. April 30th, it's probably going to be into May before that building is turned over to us. And so stay tuned again for open house, kind of mention of open house here coming up in the future. And but I also wanted to talk just a second about respiratory therapy. We're moving respiratory therapy upstairs in our building after years and years, and that renovation project is starting. It's in their old pharmacy area that we had upstairs. And I walked in there today and it's all steel studded out and beginning to start doing drywall and everything too. So another great improvement at York General that will be in the months ahead. We hope to have that finished as well. But what I would say overall on the COVID-19 front is, we've heard discussions, and I'm sure you have, Laura, or news on the variants in different states that have been cropping up. I think there was discussion yesterday that I heard a little bit on I think it's Michigan, I believe, Laura, where their variant percentages are like 60% of new cases or something. And we haven't seen that in Nebraska to that level, but we just got to be aware that it's out there and try to get more people vaccinated and trying to get on top of this and keep that going down. So hopefully we don't end up seeing an upturn in cases for very long or a very high degree before we continue to come down. So I think that's about all that I had to mention today. I don't think I missed anything on that end. So thank you for the time today. Appreciate it.
Thank you, Jim, for your report. We appreciate that.